test is quite easy. Yeah. All right. In reality, but you'll just watch the way I do it, okay? So, obviously, people present with sort of like hip and groin pain, and you have to decide: is it the joint? We've done the joints, yeah, which is the main part of my hip examination, if I'm really honest. But then a person might say, excuse my hands, they might say, "Oh, I get some tenderness in here." Yeah, and also, you know, where it is on the pube, I'm not going to do that, but where it is, you might find that you know how to palpate, okay? So you know how to palpate the origins and insertions and muscles, and then you can feel it. But you might need to fire up the muscle as you are contracting, as you're palpating them. So if you just watch now, imagine that, let's say you want to screen the musculature around the hip area. I'll show it to you, and I'll show it to you again. Alright, so you can just go through this. So watch now. So we'll start, let's start with the adductors. So someone says to me, right, oh, I've got pain, you know, it's an adductor strain. They come in, I've strained my adductors, and say, okay, let me test it. So we want to fire up the muscles. So I'll show you ways. Yeah. So let's say we want to test this muscle here. Okay. So you slowly pull your knee in that way. So you pull in, all right, and you might say, do you feel it? Yes or no? And it'll be simple. Maybe a little bit, maybe not. There is. Some people will feel it. Some people will feel it. If I just show you these quite quick, bend in both knees. My hand, all right, squeeze my knee my hand quite firmly. So that might give some discomfort. Most of the time it doesn't. So by the legs straight, this is the better one if you want to do an adductor, because the adductor's on a bit of length now. Squeeze in both legs, squeeze. Okay, and then if you're going to feel it, more likely it's that one. If you want to put the muscle onto a little bit of stretch, okay, so from here, pull in now, slowly, okay, and that might give you some discomfort. Or you can put the leg, let the leg drop out, okay, and then pull in now. Then that might give you some discomfort.
So basically you're just activating the muscle in different positions.
So you just have to test in different positions.
The muscle does,
okay. Yeah, so you know, it doesn't really matter which way you do it. Yeah, you know, you can say, right, squeeze in quite firmly, stop me. Good. Alright, both knees up. Okay, so if I just do it quickly, squeeze in tight. Good. How's that? Does it feel it? Maybe yes, maybe no. Legs straight, squeeze in tight. Okay, relax, squeeze in tight. Good, so you're just changing angles. Palpate the tendon. Put on stretch a little bit, squeeze in. Good. Maybe bend the knee. Squeeze in. Okay, different angles. Leg out. Drop over you, squeeze in. Okay, so you're just testing the adductors. There's lots of ways of doing it. And you just have to decide which way is the best one for you. So, as I said to you, that's more of an adductor, which is the common. Yeah, adductor strain, adductor longus tends to be the one that's normally involved. The adductors are also, what do the adductors do? They hip flex. So we've done the adduction. So if I ask my patient, but slowly pull your knee towards your chest, pull in, pull, stop me. Or am I tested? What you get? Hand there, pull in, stop me. Well, it's hip flexion muscle and testing. Yeah, so I'm just resisting is what I'm doing there. Alright, so my hand's there resisting. Yeah, so pull your knee towards your chest, pull in, stop me. Good. What am I testing?
These ones.
Yeah, which is?
Quadriceps.
Okay. When you say quadriceps, you mean? Okay, it's probably not good to have a rec fem because the origin's shortened here. We'll come back to that one. It's a hip flexor movement, so it's mainly the psoas, and maybe adductors are kicking in there. Alright, if I want to do rec fem, just stabilise the back with that one. Watch now, okay? So hold on to the leg. You pull your leg. No. You pull your leg up.
I pull it up.
Yeah, so pull your leg up. Okay, now. Pull with the knee.
Oh, sorry.
Yeah? Alright, so from there, so pull up. Okay, so that will be a rec fem. That's quite a good one for rec fem, for Morris. Yeah? Because obviously it works on the knee as well. If you are going to do that test, leg straight, be a little careful, okay? So if your legs, hold your leg in that position, no, straight. Hold your leg there, stop me.
So lower back, isn't it?
Well, yeah, that's why I always put the other leg, but it is a muscle test.
Yeah.
Yeah, and then you're just trying to elicit any discomfort. So
this would be also for iliopsoas?
Yeah,
or
not so much.
more for...
Yeah, more for the quads here.